Hello guys, today I'm going to show you how to pass your nursing dosage calculation exams. So I personally have these math exams every first day of the semester of my nursing program. It might be different for you, but for me, that's what it is. So I have some example questions that my school provided me. And they are just examples. I didn't get these from the exam. So I decided to use these to help you, learn how to do this correctly. So the first thing is that these little rules are very important in the exam. So you have to round to the nearest hundredth if your answer is less than 1. So the way that I think of it is, sorry, I'm trying to get this thick. So for example, in the nearest hundredth, you need to do that if it's less than 1. So like 1 milligram or 1 milliliter, that's enough, but if my answer was 0.92, my handwriting is horrible here. You need this detail because it's such a small number. You would need 2 of these. Okay, but if it's more than 1, then it's just the nearest tenth. So you could just, if this is 1 right here, then 1.9 is good. And then all the weight conversions to the nearest tenth, and it should be in the correct units, which is super important. And it can't be like, if you have units like for heparin or something, you can't be like U, because that's not a correct abbreviation. It has to be spelled out correctly. Okay, so let's start. Calculate the following children's dosage. The child weighs 22 pounds, and our order is 8 milligrams per kilogram every 8 hours by mouth. So the first thing I do is I convert the pounds to kilograms. So 22 pounds divided by what equals kilograms? It would be 2.2. If you knew that, congratulations. This is such a huge thing in these math exams. Like, if you know this, you'll get a lot of questions right. Okay? So you divide that, equals 10 kilograms. Okay, so the way I see if I'm right is that I know kilograms is less than pounds. So like 22 pounds equals 10 kilograms. And that's how I check if I did my math right. Because if I got some number that's higher than 22, that means I did this math wrong. I either multiplied accidentally, or if it's the other way around, if you're trying to convert kilograms to pounds, you should be multiplying. But usually in nursing, you have to do it to kilograms. So that's just a way that I remember. Okay. So now that we have our kilograms, we could multiply 8 milligrams with that number, because that's the total that we need. So 8 times 10. Oh my gosh. I got 80 milligrams. That's what our order says we need. And let's go back to the original picture to see. Okay, so we have 125 milligrams per 5 ml for this medication. In your math exam, you might get an image like this, and you just have to know how to read it. Right here it says 125 milligrams per 5 milliliters. That's very important. You see it's 100 ml when reconstituted in the whole vial, so you don't really look at this number. The most important number is the 125 milligrams per 5 milliliters. Okay, so let's write that down here. 125 divided by, what was it? 5 milliliters. mg, that's mg. Okay, so now we take our 80, put it over, we divide by 125, then we multiply by 5 milliliters to get our volume. Let me just make a calculator here so you can see. Okay, so 80 divided by 125 times 5. I got 3.2 milliliters for this. For one dose. Okay? And you can like double check this by doing the math all over again. And also I look at, okay, so in 5 milliliters I have this much. And I need a little less than that, and 3.2 is less, so this seems correct. Okay? I usually double or triple check my answers. Okay? Alright. So number 2, calculate the following dosage. Our order is 0.8 grams. And available we have 400 mg tablets. This is my first time looking at these questions too, so it might take me a while. Okay, calculate the following dosage. So, first thing that you notice is that we need to convert to milligrams. So, how many grams are in a milligram? Or how many milligrams are in a gram? 1 gram equals 1,000 milligrams. Okay, let's move on to the next question. I'll just like highlight it right here. Okay, so our order is to infuse 2 liters of normal saline over 16 hours. What's the infusion rate? So what I like to do is 2 liters over 16 hours. Formatting it like this really helps you just kind of understand what's going on. And also for infusion rate, we do use milliliters, so we should convert the liters to milliliters. And remember, there's 1,000 milliliters in 1 liter, so this is going to be 2,000. Okay, I'm just going to put it there. 2,000 ml over 16 hours. The next thing I do, I'm going to change the color, is, oh, let's make that thinner. Okay. So the next thing I do is I divide this until it equals 1 hour. Okay? If this was 5 hours, I'd divide it by 5. Or if it was 30 minutes, I would, if it was 30 minutes, it's in a lot of questions like that, 30 minutes, I would multiply that times 2 to get 60 minutes. That's what you want, or an hour. 60 minutes or an hour. Okay? Right? And then I would divide this by that same value. Okay? So I'm going to get 2,000. Where's my calculator? I would divide the 2,000 divided by 16. And that's 125 ml per hour. Okay? So that's the infusion rate. 125. I cannot write. Per 1 hour. ml. Okay? So it's pretty simple. Most of these are. If you have any questions, let me know, because, you know, it kind of helps to see if I'm doing this right. Alright, calculate the following dosage. Our order is 275 mg PO now. And then if we go to our paper, it's 125 milligrams per 5 milliliters. That's the most important number here. So 125 divided by 5. ml, and that's mg. Okay? And we need 275. So all we do is 275 ml, not ml, mg. And then take this one, and we... Oh, what was I doing? I don't even know. Okay, we take that right here, mg, and multiply that by 5 milliliters. Okay, so let's calculate that. 275 divided by 125, and then times 5. I got 11 milliliters. Remember, this number here, let me make sure. This right here, this value, is always what you, it's always the variable. I don't even know what it's called. What is it called? Unit. The unit is always the last one you use. Okay? That's why we multiply by the milliliters. Even if this number was 1, which wouldn't make a difference for this number, we still do that to make sure that you have that correct unit. Okay? So our answer would be 11. Right? Okay, let's move on to the next question. Make sure we're in the correct thickness. Okay, so now we're going to do number 6. Calculate the following dosage. We have erythromycin, 250 mg PO, QID. What does QID mean? So we know that BID is twice a day. QID is 4 times a day, okay? Per day. So what I think of is quarter per day. Okay? Because quarter divides into 4. QID is 4. Okay? What is the total dosage to administer in 1 day? Alright? This one's really easy. Okay, so we get, if we have 250 mg per day, not per day, per dose, and it says 4 times a day, we just multiply that by 4. Okay? So we can do 250 times 4. It's 1,000. So it'd be 1,000 mg. Do not forget that unit, okay? So hopefully you're getting the hang of this. I'm hoping, because it is kind of difficult. Alright, number 7. Order, we have morphine, 0.1 mg per kg IV, Q6 hours, PRN for pain. And our patient weighs 72 pounds. What's available is this much morphine. So what's the first thing we do? First step, let's do this in steps. Number 1, I would convert 72 pounds 2 kilograms. So we're going to do 72 divided by, oops. So we're going to do 72 divided by 2.2. Deleted my calculator again. Oops. 72 divided by 2.2. I got 32.72. Okay? That's kilograms. And then my second step, I would multiply the kilograms with the amount of milligrams I need. So 0.1 mg times that number equals, so you can take our calculator, take this same number and multiply that by 0.1. I got 3.27. So 3.27, that's the amount we need Q6 hours for pain for this specific patient, okay? But what we have available on our vial is 2 milligrams per milliliters. So we're going to take our third step. We're going to take 3.27 milligrams and then divide that by 2 and then multiply that by 1 milliliter. Okay? So 3.27 divided by 2 times 1, which does nothing. 1.63 milliliters. Okay? But what is wrong with this answer here? Like we said here, we need, if it's more than 1, it has to be to the nearest 10th, not the 100th. So that means this should be 1.6 milliliters. Okay? 1.6 ml. And this is important because let's say that the doctor prescribed you this medicine, morphine, which is a sedative. It can definitely kill you in the wrong dose. What if he put 1.63 and then then he didn't write that well, and you think that the period's here, so you say 16.3 ml. So that would be a deadly amount for this patient. So that's why we reduce that down as much as we can to prevent error. Alright. Let's move on to the next question. Okay, number 8. Kind of covered that. Order. Bolus the client with 20 ml per kg of normal saline over 2 hours. They weigh 275 pounds. What's the total volume? So, first step, we have to convert that 275 pounds. Divided by 2.2. 275 divided by 2.2. That's 125 kilograms. Okay? So now we have to multiply that by 20 milliliters. So we know we need 2500 milliliters of normal saline over 2 hours. Okay. And I think that's all it was asking us, because usually these kind of questions are like, how much would you infuse in 1 hour? But here we only need the total volume, and that's 2,500 ml of normal saline. Okay? So, pretty simple. Alright, 9. This one has people scratching their heads because this looks so unfamiliar to them. And I can definitely agree with that because when I first saw this, it was difficult for me, but it's now very easy. So we need 500 milligrams of rocephin, I hope I'm saying that right, in 50 milliliters of normal saline to infuse over 60 minutes. Tubing has 15 drops per milliliter. What is the infusion rate in drops per minute? So GTT stands for drops. And the way we do this is we need to convert from the milliliters to the minutes somehow. The way to do that is you kind of think about it. In 1 milliliter, let's say this is a cup, okay, and it has only 1 ml of space, okay. Drops, there could be 15 drops in here, okay. There could be 7 drops. There could be however many drops there needs to be to make 1 milliliter. That's kind of how I think about it, okay? So, I take this 50 milliliters and I multiply that with the 15 drops to see how many drops total there are over 60 minutes, okay? So 50 times 15, 750 GTT. And that's over 60 minutes. So how do we get that to minutes? That's the easy part. We just divide that by 60 to make it from 1 hour to minutes, right? So we just divide that by 60. And that equals 12.5 GTT per minute, which is actually pretty fast. So like that cup thing I was talking about, there's 1 milliliter. In this situation, there's 12.5 drops in this, okay? This probably isn't right, but that's the infusion rate. That's how much it drips to make 1 milliliter. I could explain this more in like a different video if you want to. Okay? Alright, let's do the last question here. Okay, we have vancomycin, 500 milligrams, IV, IV times. That's definitely an error. 500 mg IV times 1 dose. So I guess that's just 1 dose. Available as 250 ml piggyback. Infusion time is 3 hours. What is the infusion rate in milliliters per hour? So, 500 mg in 1 dose, available as 250 ml piggyback. So that's 500 mg divided by 250 ml. Infusion time is 3 hours. What is the infusion rate? Okay. So we have 250 mLs. Alright. We don't really need to worry about the milligrams. That's kind of a number that is trying to make you get off of track. Just know that this is the volume and this is how much medicine it has inside of it. So it's like already inside there. So take that 250. Oh my gosh. take that 250 ml. We need that over 3 hours. And I format it like this, 250 ml over 3 hours. So I want this down to 1 hour. What do? We divide this by 3. So this equals 1 hour. And then we do this, 250 divided by 3 is 83.33 per hour. And that's kind of where we want to be, but there's something wrong here. We need to cut off that 3. We need just 1. So it would be 83.3 ml per hour. Remember to make that correct, okay? So that's all the practice questions I have from this one worksheet. We can check if we were right. So let's go back there. Alright guys, so I wanted to clarify that drops per minute, GTT per minute, it can't be 12.5. Do you know why? Because when you have drops, you can't have half a drop or a third of a drop. It's a drop, okay? So you're gonna have to round this according to this number. So this would be 13. If it was 12.4, it would be 12. Okay? Just wanted to clarify that. Also, for the last one, that is a volume infusion. So in the answer it did say 83, not 83 point something. Okay, so 83 ml per hour. Okay? Thank you for watching, guys. I really appreciate it. Subscribe to the channel. Please let me know if you have any questions. I need video ideas. I'm in nursing school right now and it's difficult, but thank you for the support. I hope to see you in the next video. You know.